Good afternoon, everyone, and thank you for joining us today. I'm Dr. Susan Kornstein, and as a board member of the Jewish Community Federation of Richmond, I would like to welcome you all to part one of a three-part speaker series on Richmond's response to the ongoing crisis in Israel. This first program focuses on health and trauma perspectives, and it is being hosted by David Galburn, Wendy Klein, Tino Habib, and myself. I would also like to thank several other leaders of our community who are hosting the entire series, and they are Richard November, Helen Horowitz, Tommy Baer, Nanette Shore, and Josh Goldberg. And now I'm going to hand things off to Dr. Wendy Klein, who is going to get our program started. Thank you.
Hi, everyone. Okay. Good morning, good afternoon, I should say. Thank you to everyone for joining us. I'm good at herding cats. We're going to keep this very interesting program on time. I'm going to start just to share with you a little information about Richmond's response to the current crisis in Israel. Since October 7th, the Jewish Community Federation of Richmond has raised over $2,160,000 for the Israel Emergency Campaign to be sent for humanitarian relief efforts. Federation also took part in the March for Israel in Washington on November 14th, taking 300 people on 7 buses to show our support in the largest gathering of American Jews in history. And currently we have 6 people from our community on a solidarity mission to Israel, where they have visited Kibbutz Be'eri, the site of the Nova Music Festival, and have been speaking with survivors and IDF soldiers. Let me pivot back to this program, which has been organized to help us understand the trauma and health perspectives on the ground in Israel currently, as well as to support and to educate. Just so you're aware, in case you're not already, the Israeli Defense Force is the national military of the state of Israel. It's comprised of all service branches: the Israeli Ground Forces, the Israeli Air Force, and the Israeli Navy, and is the sole military wing of the Israeli security apparatus. Our IDF spokesperson today is Staff Sergeant Kelly, who is an international press liaison in the IDF spokesperson's unit. She has a degree in diplomacy and government from Richmond University, where she graduated summa cum laude, and she has postgraduate training in international diplomacy and has completed her military service. Previously, she served as a diplomatic affairs advisor to Cabinet Minister Shai in the Israeli Knesset, and we are very, very pleased to have her speak with us now to share her insights with us. You're on, Kelly.
Thank you so much. Thank you for inviting me on and for giving us a chance to speak. I'm really grateful every time a community wants to discuss what's going on in Israel and be involved, because there's so much that we're going through here. So it's hard to sometimes, sit abroad and look at all the information that's coming in on your phones and really make sense of what's going on. So I'm here to just give a briefing, a little bit of an operational update on what's the current situation in Israel in regards to the war and all our borders. And if anyone has any questions, I'll leave it to you guys to decide how we should answer. So a little bit of an overall briefing is that really and truly Israel is being attacked on all fronts. On our southern border, we are still receiving rockets from Hamas. On our northern border, every single day there have been anti-missile attacks, rocket launches, infiltration attempts. I'll get into that in more detail afterwards. In Judea and Samaria, we are also seeing a high increase of terrorism of Hamas supporters. And of course, in Israel, we are facing terrorist attacks. I'm not sure if you guys have all heard of the terrorist attack in Ra'anana, largely Anglo society living in Ra'anana, and other terrorist attacks, happening around the country. So this is really worrying, but we are in a state of war, and the IDF has really been exemplary in the way it's responding and the way it's proactively dealing with the many threats that we're facing. So what's currently going on within regards to Gaza? We are currently moving into a new phase. This means that many reservist soldiers have been released over the past few weeks, over the past week, more or less. And we are seeing that the intense force troops that used to be in the northern area of Gaza are now slowly being phased out, while we do still act within northern Gaza, and we will come to Hamas wherever they are. If we find Hamas in northern Gaza, we will eliminate them. But we are focusing more of our efforts in the southern area of Gaza in a more targeted and precise way of acting, more maneuvering, specific raids. I can give an example of a raid in Khan Yunis, in which the army took intelligence and precise weaponry and actually targeted the headquarters of the Islamic Jihad. This was a few days ago. So this is just one sort of the maneuvering that's being done, much more targeted, much more precise than what was in the north. And what has been, a lot in the news lately is a raid. The IDF, they've been saying that the IDF has been raiding Nasser Hospital, which is in Khan Yunis. And this is, obviously on the news or Kamal Adwan Hospital, and the news are very much saying that the IDF is acting in hospitals. We have so much proof that Hamas are actually the ones acting from these hospitals, which means our forces go there in order to deal with Hamas. And so a few days ago, we actually received a few attacks on our forces from within the Nasser hospital. We have the footage, we have the evidence of these launches of mortars and RPGs coming out of the hospital towards our forces. There is no shortage of evidence, and the IDF, as we continuously say, is acting according to international law. It is unfortunate that so much disinformation is being spread out there, and no matter how much we can post and try and send our message, we really are dependent on people like you, people who are exposed to not only Jews and not only Israelis, to really spread out the real messaging. And so another few things that I'd like to just cover is I'll do a little bit of an update on numbers. So far we've had almost 150,000, or sorry, there's been around, let me just get the specific number over here. We've had around 8,300 trucks of aid coming into Gaza. So while our maneuvering is changing and we are taking out some forces, what we are doing is increasing the amount of aid that's going into Gaza. We have opened Kerem Shalom crossing, and the crossing through Egypt is receiving trucks. So it's about 152,000 tons of aid. As I'm sure you've all been seeing, there's also aid now coming from Qatar, negotiations to get medical supplies. This is an issue that I can't go into too much detail about because it is mainly the Prime Minister's office and the Ministry of Defense that are dealing with this issue. But just know that the IDF are screening, they are making sure that nothing is, none of these aid trucks that are supposed to get to the Palestinian civilians have any weapons that could be used against the IDF. Just some updates on numbers. Around 12,000 rockets have been sent to Israel. 9,000 of those have been from the Gaza Strip. Around 2,000 rockets have been sent from Lebanon, and around 30 from Syria. So really all fronts, multi-front attack. And I think, something that is really worrying is what's going on in the north. In any other world, this would be a fully declared war. But the IDF is not interested in increasing and escalating. However, if the diplomacy is not working and Hezbollah do not retreat from the border, the IDF will have no option but to respond, to proactively, eliminate any threat on the border. There are 80,000 evacuees in this country, Israeli evacuees, that are now are still in hotels and hostels around the country. And this situation is unacceptable. at the very least, our civilians need to be able to return back to their homes. And currently, it is just too dangerous. So this is really a worrying situation. I'll give another few examples of some things that have been happening in the north. So there was a many anti-tank missile attacks that have actually hit civilians and not only soldiers. From Hezbollah, on Sunday, 2 civilians passed away, were killed from this anti-tank fire. And on Saturday, 3 terrorists actually infiltrated Israel from Hardov, which is on the border in the north of Israel. These terrorists were spotted while they were infiltrating, and they were killed once in Israeli territory. The situation was being monitored, but Hezbollah has an elite unit. I'm not sure if you guys have heard of it, Redouan unit. And this elite Redouan unit, their entire aim is to infiltrate Israel, to make it all the way to Jerusalem, and do pretty much exactly what was done on the 7th of October on the Gaza Strip, to the northern parts of Israel. So this terrorist organization has been many years in the making, and their intentions are very clear. And Gaza has also many years been accumulating weapons. So while we're seeing it from all arenas, we know that the source is one, and the source is Iran. Iran are funding these terrorist militias all across the Middle East. The Houthis, which have clearly proven to be a global threat to the entire maritime region and the world and the shipping industry. These are threats that are soon going to be approaching the West. Iran hates Israel, but also hates the West and the US. And so it's really an urgent situation that the entire world needs to really open their eyes to and try and prevent this from escalating further. So I'll just say a few more words on Judea and Samaria. So Judea and Samaria has been increasing the terrorist activity, but also IDF forces have increased their activity there. Around 3,000 people have been arrested, terrorists have been arrested. There was 9 terrorists belonging to a Hamas cell at the university in Nablus. So anytime the IDF senses that people could be potential threats, they are dealt with. Of course, another issue is the illegal cars that have been driving into Israel to perform terrorist attacks. And so many illegal cars are being taken by the IDF. And so we're in a high state of alert. That's pretty much a briefing on all our borders and what we're facing.
Thank you so much. I am sure that there are a great many questions, but we made the group decision to save all questions for the end after all 3 speakers have spoken. And then for all of you who are watching, you can put your questions in the chat. So we're going to save our questions in the interest of time. Thank you so much, Staff Sergeant, and we appreciate your time. I'm going to introduce our next speaker, who we're very grateful to have him with us. Dr. Ofer Marin is a cardiac surgeon at the Sharat Tzedek Medical Center in Jerusalem. He's also professor of surgery at Hebrew University. He's a graduate of Hebrew University and completed his fellowship in Toronto. And on returning to Israel, Dr. Marin joined Sharat Tzedek as a staff surgeon. Over the past 27 years, he has served as director of the trauma unit, deputy director general, and most recently, director general of the center. For those who are not aware, Sharat Tzedek Medical Center is a 1,000-bed facility, the largest multidisciplinary medical center in Jerusalem, treating nearly 1 million patients annually in 30 inpatient departments and 70 ambulatory care units. Dr. Marin, you are amazing. Dr. Marin is a colonel in the Israeli Defense Forces and has served in numerous roles, including medical battalion commander. He has served as the IDF's field hospital operations commander for the last 20 years and oversees medical relief efforts in disaster zones around the world, guiding Israel's international humanitarian efforts in response to natural disasters that include earthquakes, typhoons, and tsunamis all over the world. At this time, we have another disaster that he's been at the forefront of handling this current crisis, and we are extremely honored, Dr. Marin, to have you share your thoughts with us today. You're on.
Thank you very much, Dr. Klein, and thanks for the introduction. So I will share with you maybe two hats that I have in the last 3 months. Maybe I will start very, very briefly with the introduction that you gave about the humanitarian missions that I'm part of it, but the war, everyone, I'm sure in the States you ask, where were you at September 11? And everyone knows exactly where he was. So I was in a humanitarian mission when the war started at October the 10th. I was in October the 7th, I'm sorry. I was in a mission in Yerevan, in Armenia, for treating hundreds of burn patients that occurred over there because of the war between Azerbaijan and Armenia. They asked for assistance, and Israel was the first one to give assistance. I was the head of the delegation over there. So on Saturday morning, when we woke up, as we were treating the patients there, we heard, and I very quickly arrived back to Israel. So to share with you the challenges, I will limit my time. I know that you are very strict about it. So I will divide the talk into two hats that I have here. Obviously, the most important one is to be the CEO of a hospital in the center of Jerusalem, and to share with you the challenges. So what's happening in hospitals in Israel? Needless to say, everyone says, well, the hospitals are encountering a large number of wounded patients. So yeah, it's true. But in order to understand, even in Shaare Zedek, we have almost every day a helicopter arriving with wounded soldiers, unfortunately, from Gaza. The last one we had was a bit after midnight. We had one yesterday morning. So there is almost, I would say, a constant flow of wounded soldiers from Gaza Strip to the hospitals in Israel. The numbers that we are treating in the hospital these days, there are 5 major hospitals that are treating these patients, 3 in the Tel Aviv area and 2 in the Jerusalem area, besides the hospital in the south, obviously. But these 5 hospitals, yeah, it is a challenge to treat these patients. But the numbers we are facing now are numbers that, yeah, we can give them the best care. So every hospital in Israel, the large centers are able to treat 5, 10, even severely wounded patients per day. So obviously it is a challenge. It's the challenge because of the emotions we have. It's a challenge because of the families and so on. But from the medical perspective, we are not overwhelmed. Israel was overwhelmed in the first 2 days of the war, where we had 2,000 patients in the first 2 days, and most of them were evacuated to the south of Israel. And to be honest, in these first 2 days, it was difficult to give the best level of care to these patients. But for my chair, as the director of the hospital, there are so many other challenges. There are other obvious challenges. So what happens if the sirens go on? So yeah, if you come to Israel, they will tell you if you're a siren, just go to a safe place. That's the easy answer. But what happens if you're a nurse in the nursery and you have young babies? What happens if you have a 2-pound-year-old infant that you have to treat, or a ventilated 90-year-old lady that you are treating and the sirens are going on? What exactly to do, how to educate the people, how to prepare the hospital for the need of a large number of patients, how to educate the people, and what to do in these cases. This is a challenge. But by far, and I'm not sure that you are aware about it, by far the biggest challenge is the human resource challenge. And this has many different angles, very, very, very different views. The first is that we have a bit over 5,000 employees. About 200 of them were recruited to the army 3 months ago. About half of them are physicians. So there are departments where 1/3 of the physicians are recruited to the army. So they are recruited, the other half, the other 2/3 have obviously to take their share and to do more work in these difficult days. We had, unfortunately, a lot of staff members that their direct family members were killed. In the first week, we had 6 members of our employees that either lost their spouses or their sons in the war in the first week. And we have almost every week someone from the direct families of our employees that is wounded. So in order to try to understand the difficulties, think about the Israelis, about the hundreds of employees that we have, that either their husbands or their kids are in Gaza now for more than 100 days. It's evening now in Israel. Soon it's going to be nighttime. What do you expect from a nurse that goes to sleep at midnight, and every small scratch on the wall or whatever, she thinks someone is knocking on their door, unfortunately, maybe to give her a bad message. These are sleepless people that are worried day and night about their beloved ones. And yes, I, as the director, expect them to come to work with all their energy and the difficulties. These are people that emotionally we have to find the right way, to give them the right environment. From one hand, that they will work, they will do their best, and from the other hand, to understand their difficulties these days. There is a challenge, especially in a city like Jerusalem, which is an extremely diverse city. We have ultra-Orthodox, we have seculars, and we have Arabs. 20% of our people in Jerusalem, of the population, are Arabs. So it's 20% of our patients, it's 20% of our employees. So in the United States, you are used for diverse population. People are coming from different places, but they're not fighting each other. It's different. What happens if in October the 7th, people were slaughtered and killed in Israel and the South because of one reason? Because they're Jewish, there's no other reason. So what happens the day later when you come and you have to work shoulder and shoulder to a Muslim physician, a Muslim nurse, or Muslim employee? Is it so easy from my point to say, okay, the war is outside of the hospital, here it's different. Here we are human beings, we work hand in hand like we are doing for Sharet Tzedek was established 122 years ago. So it is difficult. It is difficult to keep the cohesion between the staff members. What happens if a patient comes and say, a Jewish patient, I don't want to be treated by an Arab. I don't feel comfortable with it. Is it okay from my side to say that's racism, but it's okay? Obviously, the answer is no, but it's difficult. It's very easy to put the headlines that racism is not allowed in the hospital, but how to implement this is obviously difficult. So many different challenges from the human resource point in this war. As I want to be exact on time, I will take this hat and very briefly I will share with you just in a few minutes another, I would say, quite unique hat that I have since the war started. So it took Israel probably 2-3 days, maybe a week, to realize the magnitude of what happened in the South. How many people were killed, slaughtered? How many people were kidnapped and taken as hostages to Gaza? So about 240 people. And after a few days, Israel realized that the victims that were taken to Gaza were people that were fine, they were kidnapped, they were wounded people, and there were bodies taken as well. People were murdered in Israel and taken as bodies to Gaza. The Ministry of Health decided to establish a relatively small committee of 3 physicians that are a mission. I'm one of the 3 physicians in this unique committee, in order to try to understand the medical condition of the 240 hostages in Gaza. Now, we all know and will understand that these kidnapped people is not the usual way that, unfortunately, the world faced kidnap in the past. but the world never faced a situation where 240 people are kidnapped, and the people who kidnapped don't say their names. Obviously, we don't know where they are, and we don't know their medical condition. We have zero information about them. And there are families that know that their beloved ones are over there. Some of them knew that they were shot. Maybe they're in a difficult condition, and maybe they're dead. And the major task of our committee is to try and gather information that we are confronted with. It can be video clips from Israel and different videos that we are getting from Gaza by intelligence people, and many, many other various intelligence information that we are confronted with. And when we gather this information, we are trying to find out which of these hostages is not alive anymore. And our mission is not to deal with the dead people. Our mission is to deal with the people alive, with the families that are in Israel and have, as I said, don't have day or night and are worried about their beloved ones. And if we are confident that they are not alive by the information that we are seeing, then we relieve them from their difficult situation. We are meeting at least once weekly. Whenever the intelligence people are able to give us some new information, then we sit, and we are sitting for hours and trying to look and to understand all of the information that we are seeing in order to try, in these unfortunate cases, to relieve the families. This committee was working really undercover until a few weeks ago. And at some point, there was a lot of public question. How come week after week, families are being told that their hostages are not alive anymore? So the censors decided to bring to public our work. In any case, the committee up to now was able to make the decisions about 26 people out of the hostages over there that are not alive anymore. I want to thank you for this time. I want to wish and pray with you together. This war is going to end, that the hostages are going to be released, and the work of our mission of this unique committee is going to end. It's a difficult task, and let's hope things will change in Israel. Thank you very much for your time.
I'm a little speechless. Thank you so much for all that you are doing. We do need to move on. I hope you will be with us for the questions in a few minutes. Okay, let me introduce our next speaker. And let me preface by saying the Israel Trauma Coalition, the ITC, is a key Federation emergency partner and is the cornerstone in the national treatment of trauma and emergency preparedness in Israel. The ITC operates multiple centers, mostly in the Gaza border area, which offer a unique model that provides a coordinated response on the continuum of emergency preparedness and recovery. I might add that the ITC is a key recipient of allocations from the Jewish Federations of North America's Israel Emergency Fund. Speaking for the ITC today here is CEO Talia Lebanon. Ms. Lebanon, I found your history so interesting. She was born in Switzerland, raised in Nigeria, and lives in Jerusalem with her husband and family. She is an MSW with over 30 years of experience in the field of trauma care and bereavement, beginning with the Yom Kippur War in 1973, where she served as an officer in the IDF. Since 2001, she has directed the ITC, and she oversees a network of over 40 organizations, again, related to trauma-related care and preparedness. She has collaborated with the Israeli government and the Home Front Command to oversee the establishment of models of trauma care around the world. And now we are dealing with the situation in Israel, and we're very honored to have you here, Ms. Lebanon, to share your insights.
Thank you so much. Thank you for having me. I listened very carefully to both Kelly and Professor Marine, and I think both narratives are very impactful on our daily work. The security situation that is becoming more and more complicated and is affecting everybody, and the human perspective that Professor Marine brought that is also part of everything we do. I will say that on the 7th, the Israel Trauma Coalition has been working in Israel and outside of Israel for many years. We are experts in trauma and experts in response. And when the 7th of October happened, I have no words to explain the shame and the anger. And then after, not much later, the pain and the grief that we are all going through. And now 3 months later, I will say with the pain and with the grief, we have a lot of work to do throughout the country. And this is what we are putting together with all our partners in Israel to move slowly to a better place. I will divide our work between the places where there are resilience centers, which is in the south of the country, and I will speak a little about that, and also in places where there are no resilience center, and there was not many models in place, especially not for treatment, and we found ourselves with a large number of teams who needed support, but also training. One example I will give you is on the 8th of October, we provided many sessions for social workers throughout the country who are preparing to deliver tragic news, just as Professor Marine mentioned. They needed to be trained in order to move forward and go into the families that were expecting or not expecting the news of the death of their loved ones. We are working with Zaka, we're working with the firefighters, we are working with the hospital teams. Again, they're very burnt out, carrying a lot of burnout over the years. But I think everybody understands that the biggest focus is the focus that we have on the resilience centers that we are operating for many years in the South. These were places that were very exposed, long-term exposed, some for 20 years, some less, for escalations and wars and rockets, but nothing prepared any of us to this enormous event. And so the resilience centers are situated, as I said, in the Gaza envelope. We also have a Bedouin resilience center and 2 other resilience centers in the area. And we divide our work between 0 to 2 kilometers, where the population was on the border, highly exposed, and the atrocities there are I wouldn't say known to all, because we're still every day discovering things that we don't want to even learn. And of course, there was the people from the party, the 4,000 mostly young people who are celebrating a party there that we are also treating, but they are not, they do not belong only geographically to the south of the country. They're spread throughout the whole country, and they are very, very vulnerable, because for many of them, the use of drugs made them highly exposed and highly vulnerable, even more than others. What we see now in our work, of course, as you know, the population is divided into almost 300 hotels. You cannot keep a sense of family. Couples with 3 children in one room for 3 months, that is not an easy situation. We see more and more couples coming for therapy. The children, many of them do not have an education system, and so they're outside, and we see a lot of behavior that we do not want to see, especially with the teenagers. And so we provide sessions for families and guidance for parents. There is a very big challenge to work over 300 hotels. We had 240 therapists on the 5th of October. We now have almost 1,000 therapists that are all either previously trained in trauma, or we are training them very quickly. They are all specialists in clinical care, but they need to also understand trauma. But I will say it's not a number I will give is if on the whole year of 2022, we had 6,000 patients in the resilience centers. Just since October, we already have 1,100. Yes, 1,100. So then it's not only a question of having a much larger number of people coming to therapy, but the content is very different. We are talking about a very, very complicated trauma. We're talking about a lot of bereavement and grief. We're talking about sexual assaults. These are all contents that if we did some of it on the 5th until the 5th of October, certainly we weren't exposed to such a high number. We are also dealing with community trauma, and which is a tool for support, but it needs a lot of working through. We're working with the communities that are spread in these 300 hotels. It is very difficult to keep a sense of community when you are divided into 2 or 3 hotels, and still much work is being done to maintain this sense of community. These communities are making now the process of deciding where to move to or if to move. Many want to stay in the hotels they are in until the end of the school year, which is June, but many are already making plans where to move to. Not all of them will go back home, at least not for the next 2 years. And so that also will maintain the feeling of being a refugee in your own country without your own home. We are faced with also the majority of the, as I said, of the teams that were exposed on the 7th of October. Many of them were fighting in the South, many were killed, and we are helping them also continue their work, but also work through their own processes. One example I will give you is out of the therapists that we had, 2 were killed, 1 was kidnapped, husbands were murdered, and these are the people who need to come back to work and provide therapy and care for the many people who are very much in need. I will say that when we speak of resilience, there are many definitions for resilience. For me, being resilient is knowing that we are vulnerable, and we do know that we are vulnerable, but also believing that we can cope. And after all these months, I will say that we are making a big effort, all of us together, to change the sense of loss of trust and loss of hope, and to bring some tools and some hope to the people we're working with, but also to us ourselves. We are still in war. The war is still going on. There are still rockets. The soldiers, and many thousands, are away from home for many months. The hostages, there is a lot of questions about the hostages, and so the exposure is still going on. But there is a sense of moving forward. There is a sense of trying to figure out how to move forward, and we know that we are doing this together, and this also is resilience. And you being with us is also resilience. So I want to say thank you very much for this conversation and for having us here.
Thank you so much. I don't know if people have put questions in the chat, but while they are doing so, please, and I encourage everybody to put questions in. We had a couple of questions from the Federation folks who have helped to make this happen. Um, one of them, describe the tensions between Israeli Arabs and Jews that you are seeing in the country.
I will give the example of the Bedouin center that we are working with. Unfortunately, 22 people were killed in the Bedouin community that we are working with. And one of the things that they say is that for them, for the first time in this way, they feel that we have a shared destiny. And when we visit the families and the families of the hostages, and we hear them speaking about how they feel about the difference now in being on the same side with the same suffering like any other Israeli citizen. I think they feel differently about how we feel about them. And so that is one example. And I think also, as Professor Marine said before, we do face teams of social workers and teams that are combined between Arabs and Jews. And this is something that needs to be addressed because, first of all of them have anxieties for their families and for themselves, and it creates a lot of tension that needs to be addressed. And we have workshops throughout the country, and I think every one of us faces this.
Dr. Marin, are you seeing increased tensions in the hospital setting?
Oh, no question. You know, I want to be honest and frank. I see tension sometimes, and not a lot, but sometimes between patients and the healthcare providers, and many times between healthcare providers, and even sometimes between patients and patients. You know, well, if you go to the hospital in the same room, yeah, you will find an ultra-Orthodox person with their Arab from East Jerusalem. And the families come in, and maybe at that same day, there was a terror incident in Jerusalem. It's so difficult. I mean, to sit now in a Zoom and say, well, the hospital is a closed environment and whatever goes outside of the hospital doesn't enter. It's difficult. Really, to be honest, in these 3 months, if you're asking what I put, maybe the most of my efforts was trying to keep the right environment in the hospital. This is, if you were asking what was my personal single challenge, if I would ask the people in the audience here, they say, oh, well, you got a very difficult patient. I'm a cardiac surgeon and a trauma surgeon. It's not that easy. But if a patient comes in and he's shot wherever in the body, we know what to do and we know how to do the best in order to save his life. But it's difficult when people are coming with their emotions. You can't do like this and yeah, everything is fine and we hug each other. With whatever happens outside of the hospital, this is the biggest mission, to keep it outside.
Well, along those lines, someone asked in the chat, can you discuss some of the innovations and changes that you have developed to better help people because of this situation? So have you made changes in terms of what you do? In terms of therapy or in terms of process, in terms of triage?
I will say a few words, and Talia, if you want to add anything, it's fine. First of all, Shaare Zedek, to say it very clear, was the first hospital in Israel to open a very large emergency room only for people that had mental burden and mental difficulties. In the first week, we treated hundreds of people that came in just because of the emotional burden. What are we doing with our protocols? And this I did from the first day I started to head the trauma unit in the hospital. Every single patient that is wounded either in war or a terror incident or an event like this, even if he's very lightly wounded or severely wounded, he will not leave the place without a social worker or a psychologist sitting with him, doing the first interview, trying to understand the impact of whatever event he encountered, and then to give him some kind of connection for the future and to try to understand if we think that he is in risk of future incidents. We are speaking a lot, obviously, about PTSD. Talia can speak much more than me about this, but I can say from my side, even from missions that I have been outside in Israel, I think that the awareness of the risk of PTSD and preventive measures that you can take very close to the event, this is the best way to prevent future incidents. Say that the United States reported after September 11 that 11% of the first responders had PTSD. That's a huge number. We're doing a lot of efforts, both on our staff members and obviously on the patients, to try to prevent.
Thank you. Again, there was a question in the chat. How is the IDF working with the hospitals and therapists in this instance?
The IDF is in close contact, of course, with all the hospitals. There are, specific floors within the hospitals that are dedicated to injured soldiers. And there we have 24/7 IDF representatives, whether it be counseling, mental health experts, doctors, volunteers, people who come and visit, spokespeople who are, getting their stories out. It's very active. And to see, the volunteers and all the people coming to visit the soldiers who are injured is very heartwarming. Of course, the more injured, the sadder the situation is. We do not want such a situation. And I'd just like to actually mention that the IDF also opened a mental health hotline. In the beginning, around 3,000 people contacted this mental health hotline. And there were about 1,300 proactive calls of people who, the Army had noticed that they had gone through traumatic events and did reach out to them. So within the IDF, not only, physical injury, but also mental injuries and like mental trauma is being taken into consideration. And we hope that, the amount of injured soldiers would just be less and less and less.
Okay, thank you for that. Another question that was presented, the ITC has received many millions in dollars in grants from the Jewish Federations of North America. Ms. Lebanon, can you tell us a little bit about how those dollars are being spent and how the needs have changed?
Yes. As I said before, we are using the funding, we're using the money to create a bigger cadre of therapists, to create more possibilities for therapy. We moved from individual therapy to doing family therapy and group therapy. And so we need experts in that. We recruited experts in bereavement. The spread of the population in 300 hotels requires a very big spread of therapists as well. As I said, we're working with the first responders. We're working with the local communities in the South. We are working with the teams. We're working with the Ministry of Social Services and with the teams of the Ministry of Health. I think every place we touch, every person we touch in Israel needs some kind of care. I will say that we need to put a very big focus on psychoeducation of the public. I do not believe that everybody will need trauma care. Everybody needs to understand that trauma can affect us and what it is that we need to understand, and also to understand and do for ourselves and for our children to prevent trauma from developing. And in that sense, also, we are very busy in providing psychoeducation for parents and for teams so that they will not develop post-trauma or, of course, severe post-trauma. And so the money is well invested in very, very hard work, but the needs are great.
Thank you for that.
Thank you.
And another question, Dr. Marin. can you give us, do you have any information on the conditions of the the hostages as they are today? Or is there any information about their status?
We're spending, as I said, tens of hours every single week in order to try and gather the maximum amount of information that we are getting. Israel is really giving so much efforts. I mean, there's probably a big gap between the way that people think that Israel is, okay, there's 136 hostages in tunnels. We're waiting for some agreement to let them out. Israel is putting so much intelligence effort. First of all, to get information where they are, what is their condition, and maybe to be able to save some of them. Whatever formal information that we have, and as I said, Tuesday, 2 days ago, we were sitting for a few hours, and unfortunately in the evening, 2 doors in from 2 families in Be'eri was notified that the two men are dead, 2 men that were alive last week, and they were killed in these last days. This is part of the work that we are doing. So this is an ongoing work. Ongoing work, as I said, every week. We were sitting sometimes on Saturday, sometimes on Friday. Whenever there's new information, within a few hours, we sit and we try and understand exactly what it is in order to try to come for conclusions, which, as I said, to come to conclusion is a bit difficult task. You cannot be wrong. You cannot let someone knock on a door and say, we didn't see the person, we saw videos, we got so-and-so information, and we can say that we are confident he's not alive. So from one point, it's a difficult task because we understand what is on our shoulders to come and say, we are confident that he is dead. So we need to be sure for whatever we are doing. But I cannot give, obviously, any other details about the other 110 people that we don't have a strict information that they are not alive. Obviously, well, we all understand that many of them are still alive. Some of them are wounded, and maybe a bit more that we were not able to identify what 100%. Maybe they're not alive anymore.
Right. All right. Not much time left. One of the attendees has asked what attempts are being made to relieve medical suffering for civilians in Gaza.
Talia, I think that was probably a question that the IDF spokesman will have better answers. I can say a word, and Talia, maybe you can say a word, but I don't know why she's somehow out of this Zoom now.
Yeah, she had to step off.
Okay, so yeah, first of all, there's a few things. There is daily hundreds of trucks that are coming into Gaza with humanitarian assistance. We know that Israel is allowing other countries to come and set up medical units in Gaza in order to try and give the maximum amount of medical care and provide care for the needed. And we should not be wrong. Israel is honestly doing the best not to injure any uninvolved person. We're doing that while taking risk of our own people. Are the Israelis that are now dead because we were extremely cautious not to hit uninvolved people? The answer is yes, but I have to be honest, were there many uninvolved people in Gaza that were injured? Unfortunately, the answer is yes. So how can you find the right balance between the risk of your own people and injured uninvolved people? This is crazy war that is in a civil area started in slaughtering civil people from a few months old Israelis to 90 years old Israelis. I don't want to tell you what Israelis that are involved in what happened in these days, what are the sceneries that we are confronted with. So
I am so sorry that we are running out of time, because we are extremely grateful for your presence with us and sharing your insights. We pray for you. We offer you all our support. I'm going to hand this over to Dr. David Galpern to end this panel.
First off, I'd like to thank our speakers from Israel. We're very appreciative of your time, and we're thankful for the discussion that you brought to our community. It's made me really think about all that you really do have to think about, having done trauma and thinking about from videos, having to decide if someone's alive or not is just, I mean, heartbreaking to me. You know, when we're taught as doctors to try and keep them alive and hope for the best and pray. So thank you for all the hard work that you do. To everybody else, I'm Dr. David Galpern, I'm a board member here at the Federation. I'm also allocations chair for our annual campaign dollars. I want to express my gratitude to my fellow hosts, Dr. Susan Kornstein, Dr. Wendy Klein, and Dr. Tino Habib for their collaboration in bringing this program to fruition. I'd also like to extend appreciation to the community leaders who are hosting the entire series: Rich November, Helen Horowitz, Tommy Baer, Nanette Shore, and Josh Goldberg. As we absorb the insights shared today, I encourage each of you to consider how you can contribute, whether through advocacy or financial support. Both are important. Our hope is that learning and understanding what we did today can help each of us comprehend the current situation in Israel and allow us to better understand how people are feeling this impact directly. The humanitarian need in Israel is urgent and great, and every effort makes a difference. Our community has currently raised over $2.1 million, and the needs and challenges are clearly still increasing. So if you're able to make a contribution, please do so. And we thank you in advance for your consideration.